Okay. Hello, my name's Caitlin. Mr. JC and I just did a health history. We're going to go ahead and move on to the comprehensive physical assessment. So I'm going to go ahead and wash my hands. And we're just going to start off with assessment of the skin. So I'm going to take a look. Hold your arms out for me. This. Taking a look at the hands, looking at the color of the skin, noting the temperature, that it's warm, that it's dry. Taking a look at the fingers, making sure there's no clubbing present. Looking at the nail bed color, noting that it's pink. Checking capillary refill, making sure it's less than 3 seconds. Okay, and then checking my radial pulses, both sides. Noting that it's a 2+. Going up the arm, still looking at the skin, checking the brachial pulses. Okay, continuing up the arms here, looking at the skin as well, looking for any deformities or edema or anything like that. I'm going to go ahead and check reflexes and strength and range of motion while we're up here. So I'm going to go ahead and have you hold your hands out again for me. Open those fingers, bend the wrist forward and back, in and out. Okay, we're going to go ahead and bend our arms like this, and up to the sky, perfect. I'm going to have you, if you can, go back, and back to the side, and up, and down, okay? And then we're going to look at strength. So I'm going to have you squeeze my hands as hard as you can, perfect. Can you put your pinky to your thumb? Don't let me break through. Okay. Now I'm going to hold your arm. You're going to resist me pushing down. Okay, resist me pushing up. Resist me pushing down. Resist me pushing up. Okay, with this, it's going to be, I'm going to push in. You're not going to let me push in. So keep your arms open. And don't let me push out. Okay, now resistance. So I'm going to push down. You're going to push up with your shoulders. Perfect. Now I'm going to have you hold your finger up. Touch my finger. Touch your nose. Touch my finger. Touch your nose. Touch your finger. Touch your nose. Okay. And check some reflexes. So brachial radial is going to be, just keep your arm relaxed here. This area. So we would see a reflex. Both sides. And then we're going to look at our bicep. Feeling the tendon, looking for a reflex there. And then you can keep your arm nice and relaxed. We're going to hit the tricep area. Looking for a reflex there. Okay. And then I'm going to check for lymph nodes in your axillary area. Palpating for that. Any tenderness?
No.
Any tenderness on that side? All right. Next, we're going to go ahead and take a look at your head. So we're going to want to look at the hair, looking at the color. Going to feel the scalp for any lumps or tenderness. Any tenderness at all?
No.
Okay, noting that the hair is brown, soft, it's evenly across his head, very symmetrical. Okay, and then I'm going to go ahead and do a few cranial nerve tests. I'm going to have you smile, frown, puff up your cheeks. Okay, good. And then go ahead and press against my hand, like push with your chin. Push with your chin. Okay. We're going to check for some tenderness in any of your sinuses. So I'm going to palpate here. Any tenderness?
No.
Any tenderness here?
No.
You can go ahead and percuss. If you're looking for any tenderness. Any tenderness?
No.
Any tenderness?
No.
And then I'm going to go ahead and feel for your temporal artery. Here. Okay, you can go ahead and take a listen for any possible bruise. Okay, don't hear any, which is good. All right, we're going to move on to some of your facial structures. So go ahead and start with your eyes. So what I'm going to do is take a look at the external structures first. We'll make sure it's symmetrical, and we're going to look at the conjunctivae. I'm going to pull down your eye. Making sure it's pink and moist, no irritation. Looking at the sclera. Sorry, going to be a few lights here. Looking to make sure it's white, there's no irritation, no yellow pigmentation to it at all. Looking at the irises, making sure that they're symmetrical, they're a very nice green color. Okay, and then we're going to do the corneal light reflex. So I'm going to turn the lights off. Well, I don't know if we'll see anything with that. Well, I'm going to have you just look straight at my pen light, and I can see that the reflection is even in both eyes. That's what we want to see. Next thing I'm going to look at is the pupils. So normally you would turn off the light just to get a better look, and I'm going to take a look and make sure that they are equal and round and reactive to light, which they both are. And I can see that there's a direct response in this eye with a consensual response following in that eye, and there's a direct response in this eye following with a consensual response in this eye. Next thing I'm going to be doing is an accommodation test. So I'm going to have you just look at the wall behind me, and then focus on my pen, and then look at the wall behind me. Perfect. And then I'm just going to have you follow this pen light. I'm going to go in an H formation. So we're going to follow it. These are the 6 cardinal gazes. Okay, I'm going to come in, keep looking, back out. Okay. And if I had my ophthalmoscope, we would be looking at the red reflex of the eye. We'd be looking at the retina and the blood supply to the retina, as well as the optic disc. Which with the optic disc, we want to see a very sharp image with a very orange and creamy or creamy pink color. Okay, so that's it for our eyes. Moving on to our ears, we're going to take a look at the external ear, palpating the ear for noting any tenderness. Any tenderness with that?
Nope.
Okay, looking for any kind of mass or abnormality. We can kind of take a look at the external canal and look for the same thing. Feeling for any tenderness in the ear?
Nope.
Looking at the external canal. Okay, and then if I had my speculum, we could look inside of the ear, and we'd be looking at the auditory canal for any wax buildup, inflammation, any foreign bodies, and then we would also be looking further into the inner ear at the tympanic membrane, making sure that it is a gray, pearly white color, because that's normal, and making sure we have a good light reflex. Okay, so nose. Again, we're going to be looking at the exterior of the nose. So we're going to look at the nasal bridge, making sure it's symmetrical, feeling for the soft tissue, noting any tenderness, masses, anything like that.
Nope.
We're going to check for patency of the nostrils. I'm going to have you hold one side and blow out. Same on the other, blow out. Okay, any obstruction or anything at all?
Yeah.
Okay, and we can kind of look on the inside of the nose. And if we had our speculum, we could also look a little bit further in, looking at the nasal mucosa, making sure it's pink, moist, and if there is any drainage at all, that it is just a clear drainage. Okay, moving on to the mouth. Again, we're looking at the external structure, looking at the lips, making sure they're moist, they're pink, there isn't any discoloration, or making sure they're not too dry. We're going to have the patient open their mouth. We're going to take a look at multiple things in here. So I can look at the oral cavity, looking at the hard palate, looking at the soft palate. Can you say ah for me?
Ah.
Okay, looking and seeing that the uvula is midline, looking at the soft palate at the same time, and looking at the tonsils. So I can kind of grade the tonsil size of 1+. Okay, looking at, can you smile? Looking at dentition. Seeing that there's good dentition. The patient had mentioned 4 cavities in the health history. Looking at the gums, seeing the They're pink, not red, not irritated. And I'm going to have you just open your mouth without sticking out your tongue. And then go ahead and stick out your tongue. Okay, perfect. And then I'm going to have you swallow. You're going to put your tongue in your cheek and resist my pushing. Same thing. Okay, I'm going to go ahead and feel your TMJ, which is your joint up here. Any tenderness?
No.
Okay, I'm going to have you clench your teeth. I'm going to do a trigeminal nerve testing here. Go ahead and clench. Feeling there. And there. Okay. I think that's it for the mouth. We did eyes, ears, nose. Okay, we're going to move on to your neck. So, again, we're looking at the neck, noting that it's symmetrical, looking at the skin, making sure there's no masses or any lesions that we need to be aware of, feeling for any tenderness or lumps overall. Any tenderness?
Nope.
Okay, so what I'm going to have, what I'm going to do next is go ahead and name off the lymph nodes that we would usually check. So these are your pre-auricular. These are your posterior auricular, occipital lymph nodes. You've got your tonsillar, submandibular, submental. We've got your superior cervical, or superficial cervical, your posterior cervical, and then your deep cervical. Feel around the sternocleidomastoid muscle. And then your supraclavicular. Is there any tenderness with any of that?
Nope.
No. Okay. I'm going to palpate for your carotid, one at a time. He's got 2+ carotids. I'm going to go ahead and listen to those for a bruit as well. Try and hold your breath. Okay, sounds good. No bruise heard. Okay, I'm going to make sure that your trachea here is midline, using both of my thumbs. Make sure that it is midline. Okay, and then I'm actually going to go behind you. You can do a thyroid gland approach, either posterior or anterior to the patient. It's actually easier to go posterior. So I'm going to have my thumbs back here and my fingers here, feeling my tissue. Okay, I'm going to have you, can you swallow without water?
Yes.
I'm going to have you swallow. Okay, and I can feel that tissue a little bit better. Can also displace the trachea and feel for any nodules or any tenderness.
No.
On the okay. So thyroid gland is normal. All right. So we're going to go ahead and do next is look at the back here. So I'm going to have you turn around if you can.
Face this way?
Yes. Oh, yeah, fine. And I'm actually going to have you do some range of motion first. So I'm going to have you lean forward with your neck, or just your neck. Back with the neck, to the side, back to the other side, and kind of do a circle with your neck. Okay, great. So what I'm doing here on the back is, again, inspecting skin. Looking for any lesions, making sure that it's a warm temperature, it's dry, all of that. And I'm going to go ahead and start off by just inspecting, watching the patient breathe, making sure there's no retractions or heaves or any accessory muscle use while breathing. I can go ahead and also, while the patient breathes, palpate and feel for symmetrical expansion. And I also want to be looking at the transverse versus the AP diameter. So we always want to make sure that the transverse is larger than the AP diameter, which in this patient it is. So the next thing I'm going to do is I'm going to percuss over his lung fields. And you want to be hearing a resonance when you are percussing over the lung fields. So we're just going to do a couple. Okay, sounds good. Now I'm going to go ahead and listen to your breath sounds. So Whenever you feel my stethoscope, go ahead and just do a big breath in and out through your mouth, okay? All right, go ahead. All right. He's got some clear breath sounds. Sounds good. Next, we're going to do lateral breath sounds. So I'm going to be going on the side here. Same thing, deep breath. Just 2 more on this side. Okay, sounds good. Next thing we're going to check, those are some clear breath sounds. Next thing we're going to check is CVA tenderness, which is the costovertebral angle on your back. Usually indicates problems with the kidney, if there's any tenderness. So you're going to feel me do a little thump on your back here. Let me find the angle. And you're going to tell me if you have any tenderness, okay? Any tenderness?
No.
Any tenderness?
No.
No. Okay. So what I'm going to have you do next is go ahead and turn around and face the front for me. Thank you. Okay, so now we're going to go ahead and do the same thing. We're looking at the skin on the front. We're looking at the breathing pattern, making sure there's still no heaves or dyspnea or any accessory muscle use. We're also going to palpate here on the front, looking for any tenderness. Any tenderness?
No.
Okay, we're also going to go ahead and listen to breath sounds on the front. Just 4 slots. Deep breath in. Okay, sounds good. Okay, and then we're going to assess for skin turgor, which is just showing if the patient is hydrated or dehydrated. I'm going to go ahead and look here. And there's no tenting, which means this patient is hydrated. So I'm going to go ahead and have you lay down with your head here on the side and feet down here. Okay. I'm going to go ahead and get on this side of you. And we're going to go ahead and move on to the cardiac portion here. So again, we're inspecting. We're looking at it's better to get down to the patient's level if you can too, just to get a better visual. You want to look at the chest, precordium area, make sure there's no pulsations or heaves. And you want to make sure there's no retractions or anything going on the chest. And then I'm also going to go ahead and palpate the precordium. Also feeling for any pulsations. Okay. And I'm also currently palpating the apical impulse or the PMI. We also want to inspect that area for any impulses as well. So next what I'm going to do is listen to the breath sounds. Listen to the heart sounds in 5 different areas. Okay, we're going to just breathe normal. We're going to start with aortic. Pulmonic. Gerb's point. Tricuspid. And mitral. Okay, going to listen to the same ones with my bell of my stethoscope. Aortic, pulmonic, Gerb's point, tricuspid, and mitral. Okay, and then also you want to listen to your apical impulse. You would listen for 1 full minute right here, and then that would determine the rate. We'll say in this patient it was 65 with a regular rhythm. Okay, and then we're going to go ahead and move on to the abdomen. So we're looking here again at the skin, making sure that the stomach is symmetrical. We can see that he has a flat contour. You also want to be looking at the umbilicus, making sure there's no pulsations there, and that it is a flat area as well. So I'm going to have you lift your head off the table. I'll be looking at the stomach and also looking at his face. Thank you. Looking for any kind of hernias. So what I'm going to do here before I do anything else is listen. So we're going to listen on all 4 quadrants for bowel sounds. Okay, and then I'm going to use my bell and listen for any bruits starting in the aortic area. Moving on to the 2 renals. And ending with iliac. Okay, and then you can move on to percussion. So we would percuss in all 4 quadrants. And this one we want to hear tympany, which we do. And then you can go ahead and move on to palpation. So I'm going to go ahead and do a light palpation across your stomach and let me know if you feel any kind of tenderness. Any tenderness?
Nope.
Okay, we're going to do some deep palpation. You tell me if you feel any tenderness.
No.
Okay, and then we could go ahead and palpate the spleen here. So what you would do is you would have your left hand under his left side. The spleen is up here under the breast area, but you want to start a little bit lower just to make sure that there is no enlarged liver that you could possibly feel. And you're going to go ahead and just do deep palpation to see if you can find that liver edge. Okay, and then the spleen, you're going to go ahead and put your hand under his left side, and also start a little bit low, palpating for the spleen. Thank you. Next, what we're going to do is look at your lower extremities. Let me go on this. So we're going to take a look at multiple things. Again, skin characteristics, looking for hair distribution. His hair distribution looks even. His skin is warm and dry. We're going to go ahead and look for, or palpate the leg for any kind of pain, tenderness, masses. Okay, looking for any edema in the legs. Checking the posterior tibial pulses, which are 2+. Dorsalis pedis pulses, which are 2+. We would also check the femoral artery, just 2+. And while we're up here, we would check our inguinal nodes. No tenderness?
No.
And we're going to listen to the femoral artery for any bruits. Okay, any bruits? No, no bruits. Okay, so we're going to check a few reflexes. So I'm actually going to go ahead and, well, we'll do the reflexes in a second. I'm going to go ahead and do range of motion. So I'm just going to lift up your thigh here. You're going to see the hip here. You're going to go out and in. Okay, repeat it on this side. Okay, and then I'm going to go ahead and check your feet strength, push against my hands, pull your toes up. Okay, and then I'm going to go ahead and have you sit up. And we're going to check for patellar reflex here. Relax those legs. Okay, you would have patellar reflex. Achilles reflex, you can't really see me, but you'd be hitting it back here against his Achilles tendon on both sides. And then holding up that foot, we're going to do a Babinski reflex. Okay. Okay, I'm going to have you lift your leg and bend it for me on both sides. Okay. All right. I'm going to have you stand up. And I'm just going to have you walk across the room. I'm going to watch your gait here. Walk like normal. And back. Okay, now go ahead and walk heel to toe. Heel to toe. Okay, watching that balance. Walk across on tiptoes. All right, and can you walk on your heels? Great. Now go ahead and stand in the center here for me. I'm going to be by you so you won't fall, but put those feet together, and then I'm going to have you close your eyes. Okay, negative Romberg sign, that's good. Now we're going to just take a look at your spine. So I'm going to have you turn to the side and stand up straight, looking at posture here. It's got good posture. We can see a normal cervical, thoracic, and lumbar curvature. I'm going to go ahead and have you reach towards your toes. Taking a look at that symmetry of the spine, see if it's straight in line. Also looking at his range of motion. Go ahead and stand up and lean back. Okay. And then you're going to go kind of side to side here. And around. Okay. And one last thing. We're going to do one last hearing test. You can have a seat if you'd like. So I'm going to have you cover this ear. Close your eyes. And tell me what you hear me whisper.
91.
Yes, 91. You're going to do the same thing. Close your eyes.
51.
51. Good job. And then we've got the Weber test, which we're testing for any kind of hearing loss. So I'm going to activate this, place it on the middle of his head, and he's going to tell me where he hears it. Okay?
Both ears.
Both ears? Okay. That's exactly what we want to hear. That's very normal. Alrighty. So that is actually it for our physical exam. Thank you so much, Mr. JC, for letting us work with you today.